Good evening. Welcome to the 40th episode of Gyan Pravah. This is the Foxy's podcast series, which is a Foxy presidential initiative. So I'm your host for this, for the episode on the 9th of every month. I'm Sarita Shamsunda. I'm the chairperson of the Foxy Gynecological Oncology Committee. I will first introduce Dr. Sunita Tandulwadkar, our president. She's a
Sarita, everyone knows me. Be brief.
Yeah. So she's the president of Foxy and a visionary leader, and she has introduced a lot of projects as soon as she took over. The Gyan Pravah is one of them, which is a podcast series, which actually is knowledge sharing, not only in the subject of obs and gynae, but a lot of life skills, which I think all of us as doctors need to know. So it's a wonderful initiative, and all of us are learning new things every day in these podcast series, which happen from 8 to 9 every day. So, Doctor, when do you want to say about the speaker and also please for your message?
Thank you, Sarita. Thank you so much. Uh, all the viewers, it's one of the most important initiative of Foxy 2025, Gyan Pravaha, which has been designed only for the chairpersons. These chairpersons are taking lot of efforts and I humbly request you to join. It's a very educative, very knowledgeable, and most important thing is the faculty we choose are from such a high repute that we all get benefited. Most important thing is 45 minutes dialogue, one to one. I think the chairperson bring out their best. Sarita, before you became a chairperson, fortunately or unfortunately, I never knew and I never worked with you. But during the couple of months what I have worked with you, I realized you are very methodical. You are the way on 4th February, the Cancer Awareness Day, you have driven 100 societies with the passion, with the social work. You compiled their reports and you submitted it. Sarita, that was one of the best committee program which you have done. And I congratulate you. And I'm so thankful that you have taken over because Foxy definitely need very dynamic committee chairpersons because they have 3 years and they can take their committee, the program, the topic, the subject of their choice, or the subject in which they are working to another level in their 3 years of a work. And I'm sure, Sarita, I'm putting another project on your lap with the MSD. You know that already I discussed on a 4th March with them. And you being a oncology committee chairperson, you will be involved. And I'm very sure you will do the justice with that. Today we have Dr. Urvashi Prasad. I don't know about doctor, but Sarita will tell us about. But if she has selected, I'm very sure she has selected the faculty of the repute. Urvashi, madam, I think you have some problem in listening or hearing. We are okay. You can unmute yourself. That speaker you can unmute and we will be able to. We are watching you very clearly. And I'm sure, Sarita, your dialogue will be of a great value. Over to you back.
Thank you so much, madam. Thank you for those encouraging words. We are indeed fortunate to have you as a president and who's been, initiating so many projects and so many innovative projects. Every day we see new things be happening. And just yesterday was the Women's Day, and we had activities from all across India, and that was really wonderful. So about the Miss Urvashi, are you able to hear us, madam?
She's trying to probably go to the place where there is a better energy.
Yeah, she
Uh,
did her book launch, so she was just saying.
yeah. So you can talk about her introduction, Sarita. We all
Yes,
are listening.
yeah. So Urvashi was a director in the office of the Vice Chairperson Niti Aayog, the Indian government's premier policy think tank. She is the only professional to have worked directly with all the three vice chairpersons at Niti. Urvashi has about 15 years experience in health, nutrition, sanitation, gender, and public policy. She has been a part of the core team supporting the work of Government of India's Empowered Group 1 for managing the COVID-19 pandemic in India. Urvashi co-authored India's first voluntary national review presented at the United Nations High-Level Political Forum on Sustainable Development in 2017. She has around 150 publications to her credit, and she's a member of the World's Economic Forum's expert network. She was recognized as one of the 75 Indian achievers at the UK Parliament on the occasion of 75 years of India's independence. Urvashi has also been recognized as one of the most influential women in healthcare by Business World magazine in 23 and 24. In 2023, she was recognized amongst the 100 most influential women in India and included in the Business World magazine's 40 under 40 list in healthcare. She completed a BSc in Life Sciences, Genetics from the University of Birmingham, UK, followed by an MPhil in Bioscience Enterprise from the University of Cambridge, and an MSc in Public Health from the London School of Hygiene and Tropical Medicine. In 2024, she was awarded an honorary doctorate in public health. And why we are having her today, she's also a cancer survivor, and she's going to tell us a lot about her journey and what about a lot of things that we as doctors may not understand. So over to you, Urvashi.
Hi. Um, so would you be asking me questions or?
Yes.
Urvashi, first of all, on the platform of Foxy, we welcome you. And we are very glad that you took out your valuable time for Foxy. And we will be listening to the dialogue between you and Sarita.
Yeah.
All the best to you all. Thank
Thanks.
you.
Thanks.
Thank you.
Thank you, madam. Thank you. So Urvashi, just tell us about yourself and your journey with cancer. Uh, how
So,
did it?
yeah. So I was diagnosed in 2022, and I have a very rare cancer called ALK positive lung cancer. And this is also commonly known as non-smokers lung cancer. And I was diagnosed at just 35 years of age. I did not have any symptoms. There is, of course, no screening for this kind of cancer. So it was a very sudden diagnosis for me. And most of my symptoms at diagnosis were abdominal. They were not even anything to do with the lung. So it's a disease that is still very poorly understood by researchers. So a lot of the understanding of this disease is still evolving. And so I was diagnosed in 22 and I was put on oral medications, targeted therapies for this drug. Of course, the first drug I was put on did not work after 11 months. And then I had to be put on another targeted therapy. So so that's been my journey in brief on that front.
So, at what stage? I mean, you were working at that time. Were you at the Niti Aayog, and how did you take it? I mean, what was your?
Yeah, I was very much working and I was a director at Niti Aayog. And as I said, I did not have any symptoms. I was absolutely fit in terms of, I had even had a complete blood test as late as February 22, and it was completely normal. And I was diagnosed in May of 22. So it was a very, very, unusual and obviously sudden progression of whatever happened within hardly a space of, days and weeks. And so I was very much, working and very active otherwise.
So, how did you, when you got to know about this? I'm sure you must have had to undergo a lot of tests to actually come to a diagnosis. So, how was that?
Yeah,
So,
so when I started having, like I said, some abdominal related symptoms, initially everybody thought it could be an infection, and then of course, I had to have a series of scans, and then eventually PET scan, and then I had a biopsy, a tissue biopsy. But even then, everybody assumed it would be an abdominal or a stomach cancer because all my symptoms were of that region. There was nothing in the lung at all. And so nobody was even thinking about ALK. And it just happened to be by chance that the sample, the laboratory, which was testing my sample, decided to test for ALK because they thought, okay, this is an adenocarcinoma in a young non-smoker female, let's test for ALK. So that was just completely random and by chance that I even got a diagnosis. Otherwise, I think people would have assumed I have stomach cancer or something, and they were giving me like 6 months to live. So I guess it also shows the challenges we have with even diagnosing something like this. And that's why when we say that we don't have enough numbers of this cancer, I think we hugely underestimate it.
yeah. So so how did you take it? I mean, and you and your family, how was
So,
uh,
yeah, I mean, I think initially I don't frankly know, how anybody took it because I myself was in complete shock. I think it took me weeks and months to even know what I had.
mm,
So I really cannot, speak about what was happening to the others. Obviously, it would be a shock to them. And nobody really knows how to deal with something like this. We assume that people can just slip into a caregiver role or into a supportive role, but that's not always true. Because sometimes people are also completely hit by something like this out of the blue. So
mm,
as much as I was shocked, I'm sure people around me also would have been. And so I think it's been a process for them also to try and see how they can support me to try and manage their own stresses, whether it's my mother or whether it's my husband. So I think it's an evolving process. None of us are really born with that knowledge of, how do you deal with such a crisis
mm,
until we are thrown into one, so yeah, so I think it's been like that for them.
yeah. So, how what I'm sure the treatment also must have been difficult. So, how was how did you manage? How did you cope with the treatment?
Yeah, treatment, in this, because treatment is pretty standard. It's this oral targeted therapy. But each type of oral targeted therapy that you take has its own unique, set of side effects. So, in my case, the first targeted drug I was on, um, that primarily had a side effect of, slowing down pulse rate, slowing down blood pressure, but other than that, nothing particularly significant. But then the drug I was on, switched to, and now I'm on, that has a whole host of side effects, right from weight gain to cholesterol just shooting up to blood sugar potentially shooting up to the neuro psychiatric side effects. Anyway, I'm on antidepressants, pretty much since I was diagnosed. But on this anti-cancer drug, I had to increase my dose, So now I have two doses, morning and evening. I have a dose each of the antidepressants. So there's a lot of other things to manage, and the heart, of course, because ultimately any such prolonged treatment does put pressure on the heart, and so you have to do very careful monitoring of the heart and whether there's any fluid around it or anything like that. So it's a very complicated thing to live with something like this. On the face of it, it's simple because you're just taking tablets every day, but there's a lot of side effects as well as monitoring that you have to do. So that makes it quite challenging and time consuming, and also of course expensive. It's also a financial burden.
Mm, yes. So, what gives you that strength? I'm sure you're very strong. So, what gives you that strength, to cope with you? Is it spirituality? Is it meditation? What helps you deal with all these challenges?
Yeah, I think there's, like I said, nobody comes with any particular preparation for something like this, and I wouldn't say that I'm any better equipped at handling it at as anyone else is. Everybody finds their own way, and you're finding it every day, right? For me, it's not even like my journey has ended. It's still going on. So still every single day is a work in progress for me, if I can put it that way. And every day has its own ups and downs. Some days are better than others, and others are not. So I think it's just about you have no choice, right? When you get such a diagnosis, you have no choice and you have to live with it. So I think even strength, it's a little bit overrated because we're all human, right? At the end of the day, we all have emotions, we all break down, we all feel pain. So it's the same with me. It's just that you have to keep just moving as best as you can, whatever works for an individual. And there's no magic formula obviously to handling something like this.
Mm.
And it's very difficult, very difficult. The world might see just one side of me, just 1% of me, but what 99% of my day might look like, people might not see. So I think all of that is there. And but certainly I think from a mental health point of view, given the amount of shock I was in, and trauma and severe depression after my diagnosis. Without the antidepressants, I wouldn't even be sitting in front of you talking like this.
Right.
So certainly, I think in terms of, just pushing me along, giving me some sort of help to even live my life is certainly those medications.
Sunita. So how did your family react to the diagnosis? And we in India have a lot, we do have a lot of family support, but um, how was that? Were there any other support systems, or was it this the family?
Um, Yeah, so like I said, it's for me mostly it's my mother and my husband is there. But I think for anybody to really be able to support in something like this, it's very difficult, especially in the initial phases. I don't think anything that anybody said to me would have made any difference. So I just had to have the medications at that time because I was in that kind of a condition where any amount of talking or counseling, nothing would help. So I think it depends, on individual to individual. Everybody reacts differently to something like this. And therefore, what is support for them and what isn't also varies. Like, being part of, say, support groups is not something I personally find helpful because for me, I don't want to keep always talking about my disease and keep hearing about it and keep hearing that, so and so has died or so and so has died. It doesn't help me,
Mm.
so for other people, it really helps to be in a support group. So I think there's no one size fits all. It really depends on what works for you as an individual. And for me, it helps to not constantly be just talking or thinking about my illness because it doesn't serve me anything. So yeah, certainly research, new research, because like I said, my disease is very poorly understood. It's
Mm.
something that even doctors struggle with, in terms of why one medication fails on one patient and the same medication works wonderfully on another patient of the same profile. So these are questions that even doctors find very hard, right now to answer. And so I have to keep up with research, of course, whatever latest, clinical trials are happening, research is happening. That is a very important thing. But in general, I don't want to keep, just dwelling on my condition and keep hearing negative news about it. because that obviously pulls me down. So I try to keep a distance from some of these things, and try to, when I'm with other people, it's just have normal conversations, that anybody would really.
Hmm.
I don't even talk about my condition unless I really want to talk about something. So that's how I think works best for me. But for everybody, there is a different, approach that might work.
Right. So tell us about your work in Niti Aayog and how Niti Aayog can is actually working for cancer.
So, Niti Aayog is a policy think tank. It's different from the Planning Commission. Planning Commission used to also give a lot of funds to states, but Niti Aayog doesn't have that role. So, it's purely functions as a think tank to bring in, good insights, inputs, research into policy making. And of course, they work with central ministries. They also work with state governments. Monitoring and evaluation is also part of their functions. So I, was the only professional who worked with all the three vice chairpersons there. So the Niti Aayog, basically the chairperson ex officio is the prime minister, and then the vice chairperson is the head in effect, functionally. And so I worked with all the three vice chairpersons that Niti has had, and of course the member health, because most of my work was on health policies. So I worked on pretty much all the health policies and schemes and initiatives that have come out in the last decade or so.
Right.
Um, so yeah, I think that for me, I was there for 8 years, so long time, and very, very wide range of experience, right from medical education reforms to COVID response, and Ayushman Bharat, everything in between. So yeah, it was a very wide ranging experience, no doubt.
Right. So there's a lot about, I know Ayushman Bharat covers a lot of the, treatment of cancers. But as regards to screening and, the prevention, the preventive aspect, so do you think, that has a role at all, the screening, and whether, they should be more in the Niti should be, I mean, the government should be investing more in the preventive aspect of things. Is there any role
Yeah,
at all?
see, NITI is a think tank, so it doesn't directly implement anything. Implementation, of course, happens at the level of states. Health is anyway a state subject in India. So the center provides, broad guidelines or frameworks, but, the implementation happens at the state level. So NITI would generally give inputs, in terms of how do we need to do better screening, or how do we need to make our primary healthcare more comprehensive so that we can have early detection of some of the cancers and other NCDs. So those are the kind of things that NITI can do, is to provide that, advice and input. But then really the implementation states have to do. And I think states, some prioritize it, so especially the southern states, where cancer has already become a big issue because lifestyle is already more westernized in that sense. They are more developed and they are more, educated, more affluent. So in South India, I think there's already a lot more focus on cancer. I think in North, we need to do much better. North, Northeast, all these areas. So I think, cancer needs a very comprehensive end-to-end approach. Right now, what happens is cancer is just kind of, fitted into some other schemes. Like in
Mm.
Ayushman Bharat, you just fit in cancer care, but you can't do that. Ayushman Bharat has only a limit of 5 lakh per family per year, and that is only for hospitalization. And a
Yeah.
lot of cancer treatment is now doesn't even require hospitalization. And
Mm.
anyway, 5 lakhs per year is nothing. If somebody in the household gets cancer and they have to have an immunotherapy or they have to have a targeted therapy, then that kind of money will just fly away, in no time. So cancer needs a dedicated approach, right? From the prevention, screening, early detection, diagnosis, treatment, rehabilitation. We don't even think about rehabilitation, that, suppose somebody is cured, but certain months or years of their life maybe have gone in that disease. And maybe mentally or otherwise they still have scars of the disease, so even though we say cured, maybe they are not fully kind of rehabilitated back into their lives, into society, so they might need help with that. But I think that is something we don't even think about, because it feels like a luxury, given that we're struggling for even the basics. Similarly, palliative care, mental health care. I think all of this
Mm.
has to be a comprehensive cancer package, because like I said, somebody like me, I would have ended up killing myself before cancer could have ever killed me, because I was so utterly depressed and lost and helpless, and so
Mm.
much trauma and shock. So, you need to have systems to deal with people like me also, right? And not everybody might react in a way where they are, very much in control. Some people might react like me, and we need to have the mechanisms, to do that, as well as palliative care. I think palliative care is still thought of as end of life care only, and that's not true.
Yes.
Palliation should start right from when your treatment starts, to mitigate the side effects of your treatment, to help you tolerate your drugs better. So it's not just end of life, but that's how a lot of people in India still understand it. That if it's palliative, that means it's end of life. So I think a lot of these things can only be addressed if we have a comprehensive approach to cancer, and we look at it like an entire package of services that we have to provide, rather than, one thing here, one thing there, one scheme here, one scheme there. I don't think you can
Mm.
tackle something, which has become such a menace, and pretty much every household, or every other household is now getting affected by it. So
Mm.
I don't think you can afford to tackle it unless you really take that comprehensive approach.
Absolutely. Yes. And a lot of families actually go into poverty because of all this, these
Yeah,
treatments.
yeah.
Yeah. So do you think, what is your message to the women? Do you think they should actually go and get the screenings done, get the whatever is possible, should girls get the vaccinations done for cervical cancer? So what do you think about that?
Yeah, absolutely. I think, certainly what is preventable, and cervical cancer, at least to a great extent, if you have the vaccinations, then you could be protected to a very great extent. And so that is something that certainly, one should go in for, because most cancers still, we don't have vaccines as such which can really prevent or, assure that you won't get this cancer. But yes, cervical is one where we have strong preventive approaches. So I think one should certainly avail of those. But the next best is obviously to screen yourself, and to focus on early detection. If you have a family history, probably you need to start even earlier than, most other people would need to. But even if you don't have a family history, I think even then, given the kind of risk factors that we are now seeing, even if you personally are not a smoker, or you're not having alcohol, or you're not obese. I mean, I didn't have any of these risk factors, but there's so much pollution, there's so much contamination in our environment. We have microplastics in our food, we have water is contaminated, air is contaminated. So it's very hard to say anymore, that, am I going to be able to prevent something just from my individual lifestyle? Of course, that
Mm.
is important, of course, because that's the only thing in your hands. But there's
Mm.
a lot of other pollution, contamination in the environment, which is sort of beyond an individual's control. And that's
True.
where governments should ideally come in, because that is what public health is all about. But I think what you can do is certainly screen yourself for the common cancers. And then if you have any symptom, never to neglect it.
Right.
I
Yes.
think with women, especially, because we have so much else going on, and we are too bothered about our families and spouses and parents and children and everybody, that we neglect. I think we neglect much more than a man would neglect.
Yes.
Men sometimes will say, oh, even a headache is, something too serious for me. Whereas women, will keep saying, no, no, I'm fine, I'm fine. And, so I think shouldn't do that. If you are having symptoms, you should try and flag those as soon as possible. It's okay. The doctor can rule it out and say it's not cancer. Everything is not cancer, obviously. But it's better to flag and better to be on the safe side. So I think that is also very important. But of course, personal lifestyle, whatever you can do, like I said, if you can avoid smoking, drinking alcohol, obesity is a big risk factor for women. So if obesity you can avoid through your lifestyle, of course, obesity we know has other factors also that sometimes can cause obesity, which are beyond, just exercising or just having a good diet. But I think for people who can control it, they should control it through these means. And obviously having a proper sleep cycle, not having a very, very sort of hectic work style. These days we talk a lot about 90-hour weeks and 70-hour weeks, and I think you have to listen to your own body. I think your own body will tell you when it just cannot take more. And I think women, we also do so much of the unpaid caregiving work, so much of household work in addition to work we might be doing outside the house. So I think we need to keep a check on these things, and we need to find time for rest and recreation. That is also very important, and time for ourselves, just downtime. I think one should not be guilty about that.
Mm.
So I think there's a whole host of things that women can focus on.
Right. Yes. So, tell us something about your book that you said you just came for your book release. So, tell us something about your book.
Um, so yeah, my book, this well, this is actually a book I'm featured in. It's called She Rose Amongst Us. So this is a story of, as the tagline says, real women, real stories. So stories of women from different walks of life. And just, their challenges, their vulnerabilities, what it has taken them to be successful in their respective fields. So, because I think the idea behind the book was that often we read about women whose lives seem, that we can't ever reach that level. Sometimes if you just talk of an Indra Nui or somebody, it feels very out of reach, right?
Right.
But women like us, women you can reach out to, women you can find on LinkedIn and just message. We wanted to talk about those women, who are still within the reach of people, and they don't feel so out of reach. So I think that's why we said real women. We have not talked in this book just about successes, but we've actually spoken about challenges. We've spoken about our learnings, what our success mantras are based on what we've learned, our hardships. Obviously, in my story, there's a lot of hardship, personal hardship, health hardships, and how have I tried to look at my career in the midst of everything. So I think there'll be some very interesting insights, for women, and women will be able to relate to it. It will not feel like this is a story of somebody I can't relate to, because they are so super successful or, so beyond our reach. So I think these are
You
successful
know,
women, but they are still very relatable, and I think that was the idea of the book.
right. So, you still, what's your work now? You still at Niti Aayog, and how do you,
I
what,
uh, yeah, I completed my 8 years there last year in August. So after that, I have been doing a lot of things independently.
right.
I wanted to have a little bit of flexibility, for now, because the 8 years I was there, I did not have any flexibility. My schedule always had to align, with that of the vice chairperson. So I wanted a little bit of flexibility in terms of being able to choose, now I can at least choose what I really want to do. And public health is obviously my passion. So I've picked up a lot of interesting projects and a lot of interesting, work in public health, in policy. I've worked on a alternative financing of cancer policy brief, which should be released next month. Lots of
Yeah.
interesting, research work, papers. I'm also trying to work on my books. something I had no time for at Niti Aayog. So I just wanted to take a little bit of this pause because I realized that at Niti I was just going, every day, day to day. There was just no time to pause, to reflect, to really do some of these things. And I think I have a lot of insights, learnings that I have got, even from my time at Niti Aayog, my 8 years there. So I want to be able to write it down, to crystallize it, to share it with people. Because I think as a public health professional, that's what I always, feel like doing. That is always my passion, right? That I want to try and share with people why public health is so important, and why they should care about it. So I think that is the kind of work I'm doing. I have my hands very full. Even now, I do a lot of things, but like I said, I can choose my passion. I can choose my projects a little bit more. So yeah, right now I'm liking this little bit of flexibility.
Right. So, what do you think about, how was your care while you having the care? How was the response with the doctors or the healthcare system, or do you feel that there needs to be a change amongst the doctors? What do you feel about that?
So I think that uh, my interface naturally was with the oncologists. And I just think that, they already have so much to do and they are already very hard pressed for time for, so many patients are waiting and there's so much for them to do that I think certain things we cannot expect just them to do. And certainly mental health is one of those. Similarly, palliative care, I think we need more palliative care specialists because these are areas of specialization by themselves.
Right.
So, to expect an oncologist to also be kind of multitasking on other things is, I think, a little too much in our context. Yes, in some other countries, oncologists do get into a lot of these other areas as well, because they might not have as many patients or, whatever it is. They also do more research. I think in our country, we don't have time. Doctors don't have the bandwidth, right, where they can really run trials or get into research. It's very hard for them. So I think we need to make cancer care more of a team, approach rather than just the oncologist or oncologist heavy.
Mm.
Because again, I come back to my example that when my oncologist first saw me, I think he had no idea, how would I deal with somebody who is in this amount of shock?
Mm.
And I always tell him that later that, whatever you said to me in the first few meetings made no sense to me. So and it's not that I'm trying to say that it's his fault. I'm just trying to say that he's not the guy trained for that. He's trained for something else, and to expect him to be able to do everything is a bit much. So I think we need more of this team approach, because not everybody, we're also oriented as people differently, right? Some people are naturally more empathetic, others might not be so much. So there's also these differences in our personalities. So I don't think you can expect one person to do everything,
Mm.
especially in oncology, which is so complex, and so I think that if we can have more trained people in specialist areas, onco psychology and palliative care for cancer, nutrition for cancer, I think that would really be the ideal kind of situation, because I've realized that you need all these different disciplines. You need all
Yes.
these different types of expertise to come together. Even physiotherapy, something as simple as that. For a cancer patient, their unique situation, their unique challenges. Even if you have physiotherapists in the team, sometimes it's very helpful. I've benefited from that. So I think that's what I've kind of realized, that yes, you have your oncologist obviously there. I mean, they're obviously leading the whole effort. But it is
Mm.
a team. And also, I think as a young woman, I felt that there is really nothing, or there's no attention given to aspects of your sexual health, your fertility. Once you get cancer, it's like over. Don't even think of these things. What do you even
Mm,
mean by sexual health? What do you even mean by fertility? So that I think has been a real revelation for me, because it's sad. I think it's personally feels very sad that my whole peer group is such, everybody's having babies and everybody's, and here I am like, okay, I should just be grateful for each extra day I get. So it's a little bit, I think we need to also look at that aspect, because unfortunately more and more young women are
mm,
getting cancer.
yes.
And so I think we need to also start thinking about this dimension. I know in the West, in some countries already, people do think about it. But in India, I've seen that almost nobody even thinks about, at least in my case, nobody thought about that. But for me, genuinely, as a patient, as a female patient, as someone still pretty young in my 30s, these are issues as well.
Yeah. Yeah, so it needs a lot of everybody together in a team, and then that and the planning, the dream, and everything actually. So even in the follow-up, and yes,
Yeah.
I think it's called quite segmented in the hospitals that we work, because there are very different departments, and the patient has to come go there everywhere. So it's quite an
Yeah.
arduous task for the patient herself to actually even get if all the investigations done, and then have the surgery, and then the follow-up. So a lot of women actually don't come back for follow-up, because they feel that they've gone through so much that they just want to not see doctors again, probably. So yeah,
Yeah.
so I think yes, a lot of psychological support,
Yeah.
and it's very much needed.
Yeah.
Yeah, absolutely. Yeah. So so what do you think? I mean, what is your message for the women? We are just a day after the International Women's Day. So this is, you're one of the strong women of our society. So what is the message you want to give to the young women and all the women out there?
I think just, sometimes being a little selfish is not so bad. I think that's what I can say to women, because I've always been someone very selfless and always thinking of others, and that's wonderful. But you cannot pour from an empty cup. I always say that. So if you're not healthy, if you're not well, you're not happy, then you can't help others also. So yes, of course, we are caring, we are nurturing women. That's how we tend to be, but let's also focus on ourselves. I think it's only after my illness that I have really started prioritizing myself, in every sense of the word, because now I feel like, well, I better do this. But I think, we should do that right from the start. And it's okay sometimes to be a little selfish, to say, I need this me time. I'm not going to be doing any household work in this time, or I'm not going to be taking care of anything for this number of hours. It's all right. I think we also feel guilty too much. And I think we shouldn't do that, because you have to be healthy, happy, fulfilled individually before you can really, do for others around you. So I think that's what I would say, to women.
Yeah, so take out that time for yourself, and yeah, you get your the rest and get your nutrition. I mean, you yourself have to be healthy, eat
Yeah.
well, and get whatever tests you need, the health checks regularly, so that you can, at least the things which you can prevent, you'll be able to,
Correct.
and then exercise and whatever is possible uh, to actually prevent these, so have a good healthy life. So I think
Yeah.
yes, absolutely, taking care of yourself is also very important. Being a woman does not mean that you have to be always serving the others. Yes. Yeah. So Urvashi, tell us, what you feel in future, what you think that as for the public policy, what other things you think should be, you think can should be included, and a lot more of how the health how the government can work into making it a much, um, more, into the health of the nation as such.
Yeah, I think that prevention is really prevention and focusing on public health. Like I said, so many things are now beyond an individual's control.
Mm.
I cannot get clean air when I step outside in Delhi. I not sure about the water, right? That I'm drinking unless I've done my own kind of filtration and my own otherwise I cannot be sure. Food, I'm certainly not sure. What vegetables, what is there in my vegetables? What colorings are there in my fruits? What is my paneer? These days we have this whole analog paneer which has been doing the rounds, and everybody is having synthetic things. So my point is, all this is public health. This is beyond an individual's remit. An individual can do what's in their control, and which are some of the things I mentioned earlier. But beyond that, it's the government. Clean air, certainly the government must provide. And so um, I think those are the kind of things I really hope that in India we get more financial resources behind public health. The funding is still very low for a
Mm.
country like India. We are too large a country to spend so little on public health and prevention. And so I think that is what we have to prioritize, because we are, 1.4 billion people. We cannot keep affording to push everybody into a hospital. There's no system on earth that will be able to do that. How many hospitals are we going to build? How many doctors will we have? We're already so short, of specialists, of everything. So we have to focus on preventive and public health, so that we can keep people out of hospital for as long as possible. That has to
Abs-
be our emphasis. That if our
Yes.
hospital beds are not full, that's our success. If our hospital beds are overflowing, that's probably not our success. So I think I really wish that we'd realize this soon, because public health is not just for society, or not just because people's lives are at stake, which is of course a big enough reason to focus on it, but also for your economy, right? We are talking about workforce, we are talking about productivity, we are talking about Viksit Bharat at
Yes.
2047. How are you going to achieve this if you don't have healthy people,
Absolutely.
healthy, mentally, physically fit people?
Yes.
So we are your workforce, right? I'm part of the workforce. And if something like this so horrible happens to me, and if I'm unable to work, well, you've lost a very competent member of your workforce. So you have to
Mm.
look at it that way. An investment in health is not an expenditure. It's an investment that's going to give you a huge return, several multiples. And that's what I keep trying to convince, wherever I go, whichever forum I go. I really try to
Right.
convince the people there that don't see it as an expense. Please see
Mm.
it as an investment in the future of your country.
Yes, absolutely. I think that's so very important, to have a healthy nation and healthy young people and people in general, to have to have the economy to grow. Yes, so I think yes, that's it's really important, for all of us. Uh, First of all, to concentrate on our own health
Yeah.
and get and the government, get it from the government as far as possible. Yes. So thank you so much, Urvashi, for this wonderful interaction. I think there's a lot that we learned from you, and also there are so many ideas for all of us, and a message for the women and all the girls out there to actually, first of all, take out time for yourself, and whatever, have a healthy life and a healthy future ahead.
Thank you. Thank you so much for having me. And I apologize for some of the logistical issues because I'm outside, but hopefully you could hear me fine in the end.
Yes,
So,
yes. Good. Yes,
yeah.
yes. So
Okay.
we would love to know more about your books and about your publications. So that would be really nice. We can, for us to go through. Thank you so
Sure.
much.
Thank you so much. It was a pleasure. Yeah. Thank you.
And thank you, support team.